Hi, my name is Julie Leezer. I'm doing my presentation on sensory processing disorder. First, we're going to talk about what is sensory processing. Sensory processing is the process by which our brain takes in sensory input and interprets this information for use. The process allows us to experience and respond to our environment. For example, our senses allow us to enjoy a beautiful landscape, to find pleasure in a hug, and become famished when we smell our grandma's apple pie baking. When our senses are working together in an appropriate way, they protect us and allow us to enjoy our surroundings. Our most familiar senses are vision, hearing, touch, smell, and taste. Two other senses that are less familiar are vestibular and proprioceptive. Our vestibular system provides sensory information that is related to movement and balance, while our proprioceptive system provides sensory information we receive from our muscles, joints, and body parts. All of these senses work together to help us understand and respond to our environment. So what is sensory processing disorder, or SPD? Sensory processing disorder is the inability to respond appropriately to ordinary sensory experiences. One or more of a child's senses may over or underreact to sensory information. This is a result of senses not working together properly. Children with SPD have difficulty responding effectively to their environment. How is SPD diagnosed? Sensory processing disorder is a very comprehensive and complex disorder. Due to the fact that so many children with SPD also share other diagnoses like autism, Asperger's, developmental delay, obsessive compulsive, and anxiety, the medical community does not always embrace and recognize SPD as a researched, evidence-based diagnosis. As a result of massive advocacy from both professional fields and grassroots organizations, sensory processing disorder is now recognized in the Diagnostic Manual of the Interdisciplinary Council on Developmental and Learning Disorders, and soon will be included in the DSM-5 under neurological diagnosis. The Diagnostic and Statistical Manual of Mental Disorders, or the DSM-5, is the main diagnostic manual for the medical profession. The DSM-5 will be available in the year 2011.